Carter County inmate recently diagnosed with hepatitis A is claiming the jail did not do enough to prevent the spread of the disease.
This comes as the state health department is fighting an increase in cases. According to the CDC, Tennessee has the fourth highest rate of hepatitis A in the country, with nearly 2,600 confirmed cases and 22 deaths since December of 2017. Jackie DeFusco asked the sheriff's office and the regional health department to respond to the inmates' accusations.
Sarah, drug users and homeless individuals are both at high risk for Hep A. And of course, both groups can be found in jails. Now, the health department says high turnover makes regular vaccinations critical so that the disease doesn't spread to the community.
I don't want this to happen to nobody else. I'm not trying to get no lawsuit. I'm not trying to get out of jail. I just want them to give more medical attention.
That's John Hudson, a current inmate at the Carter County Jail, speaking on the phone with News Channel 11 October 6. Medical records show 4 days prior, he was admitted to Sycamore Shoals Hospital, where he was diagnosed with acute hepatitis A.
And as soon as they know about it, we recommend to isolate the person that has hepatitis A so they can't spread it.
Hudson says that's not what happened when he returned to the jail.
There were words to me when I said, well, I need to be quarantined. Hudson, you're not going to get a cell by yourself. You're going upstairs.
A sheriff's department spokesperson says the inmate diagnosed, quote, remains in isolation and no new cases have been reported. Casey Smith says her husband was housed in the same pod as Hudson before and after his diagnosis.
The guy had open sores underneath his arms. They share water and food. Also, there's not enough bunks to house the people in there. There's supposed to be around 22 people in the area that they're in, and there's anywhere from 35 to 48.
Smith says she first reached out to the health department and the sheriff's department more than a month ago to get her husband vaccinated.
Their response was way too slow. It took me contacting you, honestly, for them to even get them to go out there.
News Channel 11 reached out to the sheriff's department and the health department about Smith's concerns October 9th. A spokesperson for the sheriff's department says inmates were vaccinated October 10th, about a week after Hudson's diagnosis.
So we go in as soon as possible after we hear about it. Sometimes there's some logistical stuff, like our vaccination team might already be vaccinating at another jail.
The sheriff's department says they first contacted the health department October 8th. The health department wouldn't confirm that, but says state law requires they be contacted immediately after a case is confirmed.
So a telephone call to the health department, like as soon as the lab comes back positive.
The health department says vaccinations are effective within 2 weeks of exposure.
You can infect other people for 2 weeks before you start showing symptoms. So that's one of the reasons hepatitis A is a little bit difficult to contain.
According to medical records, Hudson reported having multiple symptoms of Hep A 3 weeks before his hospital visit.
It's not fair to subject them to diseases like this to bring home to everyone else.
The Carter County Sheriff declined to do an interview. In a statement, a department spokesperson said the jail transported the inmate to the hospital immediately after he displayed symptoms. Now, that statement goes on to say that any claims that vaccinations have not been made available to inmates are simply untrue, and that the Carter County Jail regularly offers voluntary Hep A vaccinations to inmates every other month. Josh, Sarah.